Well, I'm Mike Cook. I'm president of Global Offsite Care, and I have with me Brian Bauer, a fellow director of Global Offsite Care, who recently visited a project. But first, a little context. We're talking about global telemedicine, right, Brian?
Yep.
So, how did you get involved and what attracted you to global telemedicine?
Well, the Rotary and just in general, I'm really impressed with everything internationally that Rotary does. Ever since college, I studied engineering, so I like a real strong technology background, but I studied a lot about how to work ethically in a global environment and how to extend technologies, appropriate technologies, to different countries and underserved areas. And it was a natural thing to join Rotary, and I was really impressed and with the medical aspect because I did a project in Thailand and Burma where actually it was one of the projects that you had initiated. Very exciting, where really rural parts of Burma had really hard times birthing children, and there were actual health workers that weren't necessarily doctors, but we provided backpacks and the medical supplies and backpacks. That was fantastic for helping them get into rural areas and do that. I was so impressed with that project, driving 8 hours backcountry to help with that. That inspired me a lot, and doing more medical underserved areas with Rotary. So that was maybe 12 years ago, and more recently when you were president and Gail Thomas asked me to join as a director, as a founding director, I said, of course. So we respect our seniors in Rotary, but then it was a very exciting project for me. So I really enjoy doing this.
Well, great, and we're glad that you got involved. Our very first project was in Manila, and you were there to help start that. But more recently, we launched a project in southern Philippines, and you visited there in July. So tell us about that.
Yeah, so it was expected to be a rural, poverty-stricken area, and actually it actually fulfilled that in every way. I flew in the southern part of the Philippines, which is known quite a bit for its different politics and being a very chaotic area in a way. But in the last 10 years, it has calmed down quite a bit. They believe very strongly in socialized medicine and having the government help any way they can. So that was really nice in that they set up a central location in Zamboanga City that had a really good staff for this type of thing. And what Rotary did is to complement what was going on with the staff there and reached out to, now it's 22 different rural sites. Some of these, this is another 8-hour Rotary trip back to the backcountry. In this visit, we went to 2 or 3 different sites, and what they call hospitals there, they don't have a lot more than some homes here in the U.S. as far as medical equipment. Mm-hmm. There's birthing tables, there's IVs, there's basic test facilities, but not a lot of facilities. So they need to refer out a lot. A lot of sites only have nurses and 1 or 0 doctors. So it was really fantastic to have the appropriate technology there, like what Rotary provided, which was the desktop computers, help with the internet, some battery backup, and then a suite of different technologies, like ultrasound, handheld ultrasound that's very low cost that can be used in specific locations where it makes sense. So that was a real eye-opener as far as very little facilities. And if we're really smart with not a lot of funds, can go a real long way in helping referrals and actually getting people to where they need to within the country.
Well, that's fantastic. It's good to hear that we're having an impact there and that they're taking a little bit and making it go a long way, which is wonderful. And I think another trait of international service is to see how far the recipients can make the resources go. So I like that. I also like the central facility for hosting Asia Grand Rounds and other services that none of our other projects are doing at this point. Anything else stand out for you about the current project, about how it's working?
Yes, so one of the most important things is that there's a Rotary champion as well as doctor that's a champion. And sometimes they're the same person. At this location, there was a Rotarian that helped fundraise and organize, and then there's a doctor that ran the hospital. Actually, the doctor joined Rotary as well. So that's the buy-in and the culture belief that telemedicine can make a difference and actually implementing at the management level is critical. There is a really charismatic person in charge of Zamboanga City telemedicine, and you could really feel his charisma throughout the country, and that's critical to having a success. So what's going to be very important in these sites is once he moves on to whatever he does, can that sustain itself? And so it will always, like with any company or large organization, the culture from the top is important, but any infrastructure that we can set up, framework we can set up to be sustainable will be great. Because you don't always have it in every leader. Yeah.
No, it's true. And you were telling me that they also created some software to manage the telemedicine. Did you see that working?
Yes, so it's very interesting. So from the day zero, when we first did an introduction of a Rotary telemedicine project in Manila, I don't know, maybe that's 8 years ago, we tried to implement a very complex medical records software made in the US by Silicon Valley type people. It was meant to be fairly simple, but still not simple enough. So it was really struggled to get that project off the ground. This coming back 7 more years later, what happened here with Zamboanga City is they were using Facebook and Google Sheets to track things and keep and communicate with people in their original telemedicine medical records and so forth. But then they realized we should write our own software. We have access to resources that can write software. And so let's make it the way we think is simple, learning from Facebook and Google and the experience, looking at other software out there. But the key is, and this is for anybody, is if you can do it in 1 or 2 clicks, get to where you need to go, you use it. If it's 4 or 5 clicks and you have to wait for a download for another page, it's gone. It won't be used. They have done such a fantastic job with 5 to 10 software guys to write this, and it's been really effective. It's so effective, and I had a chance to look at it a couple times. That's something that could be used globally. They're willing to share it with the rest of the world as well. So I think it's fantastic, sort of grassroots. This is what we need in a rural environment type of thing.
Well, that's kind of a good segue because I wanted to get your take on the next few years. What do you see happening with global telemedicine and our program?
Well, I think it was so, like within our central organization, we started out wanting to promote this really cool, super technical robot, big thing that kind of walked around and everything. And we realized over the years, one time after another, that it doesn't need to be that complex of a technology. So the future isn't necessarily more technology, it's appropriate or simplified technology. So it can be revised, but in some cases it'll be revised simpler. So I think things like the ultrasonic remote device that's very small and low cost, more things like that will go a long way. Electronic stethoscope, maybe, that goes back into the cloud and figures out the form of the heartbeat and what is the condition that's matched, and that can come back. Those will be appropriate in some places, in case-by-case basis. So as those technologies come and they're lower cost, those will be implemented. And so you'll see a lot more of that. But you'll never go away the human factor and applying and listening to the different regions and different locations on what they will actually use. So that will always be with us, and that's great. And we'll see case by case what's actually used.
Yeah, I think the whole human service side is what really propels us, and the equipment's secondary. Well, thank you very much for sharing your perspective. You have something else you'd like to add?
No, I would say thank you, Michael, for doing what you do, doing the birthing attendant project early on. It was very inspiring, and it's led to a lot of wonderful experience by myself. Thanks.
You're welcome.